IB Times UK has come down to St Thomas's Hospital in London as thousands of NHS workers across the UK walk out in a row over pay. We're here to speak to some of the staff taking industrial action. So obviously you're striking in this row over pay, but I seen this morning the Health Secretary, Jeremy Hunt, says if he meets your demands from the unions, he would actually have to cut jobs. What do you got to say about that?
Well, it was the independent pay review body that gave the 1% pay rise, and one of the things that the pay review body looks at is costing, that it's actually going to be affordable for the NHS to be able to provide it. Because part of the problem is that if you don't have a demotivated workforce, then they don't work as efficiently. So paying the extra 1% may actually save the NHS money in terms of workers dropping out and low morale.
And with regards to the strike for 4 hours and the later industrial action, isn't there a worry that you're creating undue stress for some of the patients in there? I know they said you're offering life and limb services, but just for the normal patients.
Yeah, well, the services that we're running are what we would run normally in the hospital. So all of the maternity wards, the birth centres, things like that. No one's going to be giving birth by themselves. Postnatal wards, antenatal wards, that's all running. The only things that aren't running this morning are the standard kind of antenatal clinics that they would be going to. What we're running this morning is kind of a bank holiday service. So it's the equivalent of being a bank holiday for basically 2 hours, because the clinics wouldn't start until 9 o'clock.
Surely isn't that going to have a detrimental effect on patients who, frankly, it's not their fault, is it? The rows with the government.
Well, yeah, it means that they're going to be waiting another couple of hours this morning to actually be seen, but we wouldn't be doing anything that would be doing any harm to patients.
The Health Secretary this morning, Jeremy Hunt, said if he met your guys' demands that he would actually have to cut jobs. What do you have to say about that?
I think he's being disingenuous when he says things like that. And if an independent pay review body has recommended a 1% increase, then I don't understand why you have an independent pay review body if you don't trust their advice. I think Jeremy Hunt's proven himself to be untrustworthy in a lot of other ways as well. So I think it's probably the usual kind of smoke and mirrors that come out whenever unions elect to take strike action of this nature to try and take a stand.
And with regards to the 1% pay increase only for a few and not for the others, what sort of effect does that have on your members?
Well, it has different impacts on different pay bandings, I think, because we have very low paid members, but I think it's very demoralising, and I think the job that our members do in the NHS is very important one way or another, and morale is naturally affected by that, but particularly for our lower paid members, this is coming against the background of massive cost of living increases. London rents are insane, as I'm sure you know. Rates have risen in several ways. The benefit sanctions of all kinds have been coming in across the board, so a lot of our lower paid members are generally struggling to make ends meet completely. And across the board, even the higher paid members don't feel that they're being valued for the work they do, which is very important, as I'm sure you understand.
Yeah, and I understand that you guys, the workers, are offering a life and limb service today, but obviously it will have detrimental effect to some extent on some of the patients, and I mean, they're not really involved in this row. What have you got to say about that?
Well, I mean, this isn't really a dispute with patients, and it's not a dispute with our employers in this particular case. This is really about the government's policies. We really think that in order for the NHS to function, it needs to be funded properly, and you need to have a motivated workforce. So sometimes, as much as we don't like to do things that affect patients, you have to take action to try and benefit things in the longer term. So I suppose our message to patients would be we're doing this because we care about the NHS, and it may have some impact in a relatively short-term scale today, but we are providing life and limb service, as you said, and that we're doing this for the right reasons.